Hi, I just wanted to spend a couple of minutes talking about this week's topic on health insurance. I wanted to go over some things that I found complicated or important for us to know. Trying to decide what sort of health insurance you might need is complicated. It's helpful to know about what are the different types of health insurance plans, what benefits do they provide, what's covered, and then also I think it's really important. I've seen in my own life the importance of talking about long-term care insurance. So, health insurance premiums are really expensive. A health insurance premium is the amount that you're going to pay into the plan to be able to access the benefits of the insurance. So the premium is like your life insurance policy premiums or your car policy premiums. What do you have to pay to access those benefits? For a single person, now they're well in excess of $7,000 per year. For a family, in excess of $18,000 to $20,000 for full family coverage. For these are average annual premiums, so we're getting the whole range of policies that cover a lot of things to policies that don't cover much, and we're looking here at the average policy premiums that are paid on an annual basis. So they're very expensive. And what do you get for that? So you are going to be able to access the benefits of either an indemnity or a managed care plan. The managed care plans, I'm not going to go through all of the details of, all of the different types of managed care and indemnity here. You can read about that. But, basically we're talking about indemnity is a fee for service where you pay a deductible, and that deductible might be anywhere between $1,000 and $10,000 a year before your insurance plan is going to kick in any benefits for you. And the managed plans are going to be things like HMOs, health maintenance organizations, PPOs, preferred provider organizations, point of service POS plans, which is a sort of hybrid HMO, or exclusive provider organization, an EPO plan. There's differences between each of those plans. Essentially, the differences are cost and amount of coverage and type of coverage within or outside of network. Even in Humboldt County, our HMO is monitored or administered by the Humboldt IPA, which is a for-profit company. So they will work with providers to decide if what you're requesting should be okayed and should be something that is covered by them, and then negotiate, contract out the fees for the services provided by the doctor or the hospital. Also, people who are eligible for Medicaid, meaning they're low income and can't afford any health insurance, they'll be covered by Medicaid. Those who are over 65 under the Social Security Administration will be able to access Medicare benefits. Even gaps in coverage in Medicare need to be sometimes provided for depending on the amount of care that someone needs. They would have to access a private policy to provide for those gaps in coverage where they aren't covered for something that they might need, where Medicare coverage, is not meeting their needs entirely. Okay, so let's see. You can read all about the differences, and I wanted to show you okay. I wanted to show you this information here. So a lot of people are using these bronze, silver, gold, and platinum plans that are provided by under the Affordable Care Act. So the Affordable Care Act in the Obama administration is a way of providing health insurance for everyone. There is a tax basis for this. So those with higher income pay into these health insurance schemes to reduce the premium payments for lower income individuals who then are able to access. So they might be self-employed, or and they don't have insurance from their employer, and they're needing health insurance. So they can, but they're also not people who qualify for Medicaid, which is a much lower income level. So the Affordable Care Act uses a tax redistribution system where those with higher income, their salary is taxed over a certain amount and their investment income is taxed over a certain amount. And then that's reducing the costs of these health insurance plans for those who are not insured, to increase those that are insured, because hopefully overall that should lower costs of health insurance or health care costs for people. If you want, I can show you this. So you can go to healthcare.gov, and there's also going to be state pull downs for this. So like for California, you can visit your state marketplace and you can get information if you give them your income and your zip code and how many people and the age of people needing coverage. They can give you information about different plans that are available to you. So we'll just kind of stick with California for a minute here. And you can see there's the bronze, the silver, the gold, and the platinum. So for example, in the bronze, it's estimating that you're going to have to pay about 40% of your healthcare costs, and the plan is going to pay about 60%. So when looking at these different types of plans, you might want to ask yourself some questions. How often do I go to the doctor? How often do I have accidents? Do I have a medical condition that requires doctor visits, prescriptions, hospital stays? That's going to influence the kind of health insurance that you might want to purchase. Okay, so let's go back to our PowerPoint presentation. Okay, so questions, things to consider. Are you also avoiding things that could cause you to have problems now or in the future? I think that's another really important question. Okay, so ask yourself the following questions when choosing among healthcare insurance plans. If you're looking at these different plans, am I able to choose any doctor, hospital, clinic, or pharmacy? Does that matter to me? What is the coverage that's provided when I'm seeing a specialist? Does this plan cover special conditions? Does the plan cover home or nursing care? What kind of limitations is there on the coverage of different medications? What are my deductible and copayment amounts? So a deductible is going to be this amount of money that you have to pay before your plan pays for mostly anything. And you have to read the fine print on, what is that deductible, and is there anything that they pay for before you meet your deductible. Sometimes they'll pay for preventative care services. Sometimes they'll pay for preventative visits, like an annual doctor visit. They might pay for that, but they might not pay for, I have the flu and I need to go see the doctor. Those types of visits, you might have to pay for that in full until you hit your deductible, and the deductibles can be very high. Are there any copayment amounts that need to be paid? Copayment means, or coinsurance is the participation of the insured. So if I go in for a doctor visit and I have a copayment, maybe I have a $20 copay, or maybe I have a 20% copay for doctor visits. What is the maximum amount I would have to pay for healthcare expenditures in a calendar year or during my lifetime? I think these are all really important questions to sort of look at when you're deciding between a plan. So your text has this really helpful comparison, and there's comparison tools when you're assessing healthcare plans in these different places like the marketplace. So if I go into the bronze plan, it's going to say standard bronze plan. Okay. And, you can shop and compare. And so you might be able to go in and compare, you'll, give some basic information, and then you can compare the plans side by side to see which one works for you. And you might want to ask yourself some questions here, like how much hospital care do they cover? What's their policy for surgery, office visits? You might be considering certain things, like maybe you're planning on or already have a child. Maybe you might have more children. So you need to look at things like immunizations. Maybe you have family history that you may need to be concerned about in here. You're on a maintenance prescription drug, etc., etc., etc. So doing a comparison of the different health insurance plans and what the policy covers is really helpful. And there's often tools when you're buying health insurance to help you make those decisions. Okay. Those are most of the things that I wanted to talk about with regard to health insurance. I also wanted to talk a little bit about long-term care. Long-term care, that is something that is becoming more and more important as people are aging, and we have older family members who don't have long-term care already paid for. They don't have long-term care insurance, and all of the people in their family are working. Their children and their grandchildren are still working. It's really hard to find someone to take care of them in the right way, because it's very expensive. So a private nursing home care facility could charge $200, $300 a day. People often need long-term care for lengthy periods of time. And in long-term care insurance can be expensive. When you're younger, your employer might actually pay a long-term care policy for you, and you're assuming you're not going to need it, but if you do, it's there for you. And as you're aging, it might be something to look into, aside from saving, right? So if you're saving, maybe you can pay these nursing home care costs. But also, it's important to think about maybe trying to purchase a long-term care insurance policy at some point in your life, so that those in your family, they won't have to worry about how to pay for your care or have to care for you. Some questions to kind of ask when it comes to long-term care is, do you have assets to preserve for your dependents? Are you able to afford the premiums? Is there a family history of a disabling disease where you may require long-term care? Are you male or female? This is often really important. Females tend to live longer, and they may be caring for their husband or spouse. And maybe that husband doesn't need long-term care insurance, but maybe the wife does. And we're kind of just talking about in a traditional sort of dichotomy here, and what we might have seen in older generations. It may be different going forward. But in what we have seen in the past, aging relatives, the wife, the female spouse, is caring for her husband, the male spouse, and he might pass away, and then she might need long-term care insurance and long-term care in general. Do you have family to care for you? Maybe you have family to care for you, and this isn't something you need to be concerned about. There's a lot of limitations on what is provided in the long-term care insurance, so something to sort of think about and plan for and be aware of. Okay. That's kind of all that I have. I just kind of wanted to jump in here, kind of get everybody to start reading this information and learning about it. Health insurance is really complicated. Health costs are rising, aging population in our country. So, I don't believe it's likely that we'll see the cost of healthcare and the cost of health insurance to decrease anytime soon. So I think it's really important to at least be knowledgeable about it and be proactive. There are benefits out there. The Affordable Care Act is very helpful depending on your income level and can provide you and your family with some comfort. Okay, well, I hope this information is useful to you, and have a great week.